Good afternoon, everyone. Welcome to NASM Optima Online. My name is Prentiss Rhodes, and I'm here with Dr. Kyle Stull and Rodney from Eleiko. And we're going to continue our discussion regarding corrective exercise and Olympic weightlifting. And in the first webinar, hopefully we were able to make the point that what corrective exercise is really just coming up with a targeted flexibility and strength training program for your clients so that you can help them to their goals, help them get to their goals more efficiently, which in this case is performance in Olympic weightlifting. Now, what we're going to do today is go a little bit deeper and really show you how to come up with that corrective exercise program through a couple of case studies. So let's talk a little bit more about the agenda, and then we'll dive right in. So if we go to the next slide. What we're going to do is today talk about the CES assessment flow and talk about how you kind of walk through that with your client depending on what they're showing you at each level of assessment. We're going to give you two case studies and stay until the end. We'll have another giveaway, so you want to hang on to get those promotion codes. And I am absolutely certain these two gentlemen will be willing to answer all of your questions about corrective exercise and Olympic weightlifting. So fire away. Now, gentlemen, let's start with you, Rodney. How are you doing today? And how are you doing today?
All is well.
Okay. And Dr. Stull, the man who wrote the book on self-myofascial techniques, how are you today, sir?
I'm doing all right, and I wrote a book based a lot on the chapter that Rodney wrote back in 2001. I just looked it up today, the publication date of that NASM Optimum Performance Training text.
All right. Awesome. And just as a reminder, you can save 15% today on Eleiko apparel and equipment. And you'll also be able to save 35% on the new CES. So let's just hang on to the end so that you can get that promotion code. And let's start off with the assessment flow. Kyle, can you review for us what we did in the last webinar, what this assessment flow is, and how we use this to the benefit of our clients?
Absolutely. So in the assessment flow, or anytime we're doing assessments, we need to have some sort of a process, some sort of a systematic process. We call it here an assessment flow. And just the word there, I want you to think of this as we're going from A to B to C, or 1 to 2 to 3, and we're always using the information from one assessment or one test to inform the next assessment and the next. And what we're really trying to do here is we want to value the client's time. They're paying by the hour. You know, we can break that down into by the minute and by the second. They're paying for every minute, so we don't want to take them through a barrage of tests or assessments. It is not actually going to inform our program. So that's the reason we have the flow here. So the first thing we're going to do is intake. We need to know about their medical history. We need to know their goals. I think a lot of times whenever we're thinking about corrective exercise, we get lost thinking that, well, our goal is to improve movement quality, but that's usually a secondary, or in some cases, it's even a tertiary goal in the eyes of the client. They have something else they want to accomplish. We need to take that information in so we can integrate it into our program. If they want to lose weight, well, we're going to design our programs in a manner that's going to help, enhance calorie burning potential. So we take the client intake, and after that, we're just going to take a quick look at them. Like the other day, their posture is typically a representation of their habits. So we're just going to take a look at their static posture. However, if they have poor posture when they present statically, it doesn't always mean that they're going to move poorly. So then we're going to take them into the transitional assessments or the overhead squat assessment. And here's where we start to get a little bit more picky or a little bit more detailed, if you will. If we see compensations in the overhead squat assessment, we're then going to move to our two modifications, which we'll discuss in here a little bit today. One modification is going to be elevating the heels. The other modification is going to be placing the hands on the hips, and we're going to use that to direct or guide our focus. So that will help us identify what a root cause may be to their movement impairment. If we get from that overhead squat assessment, if we see the compensations and we get valuable information, we can design a program that could be as far as we go with the assessment process. Some clients from there, we could go right into designing a program, or we could skip down to those mobility assessments, which is going to help us confirm what we see in the movement, and also give us some more subjective data. So we can take a look at how they're moving, the range of motion, and then we can come back and retest that. However, if they do well in the overhead squat assessment, then we're going to reduce the base of support and change some things up by taking them to a single leg squat assessment or a split squat assessment. Again, if we see the compensations here, that may be all we need to design a wonderful program. Or if they do well, then we can take them a step further. We can get to the dynamic assessments. These are going to be a bit more complex. A lot of times we're looking at more eccentric control or reduced base of support with these. And we can do a loaded assessment, which we'll talk a little bit about today as well. Then again, there we use that information to come back to mobility assessments if we need it. And then we're going to take all that information and design our corrective program. So.
Thank you for that. And if I may, I want to ask you a really quick question before we dive into our first case study. Oftentimes, I've heard feedback that our students have the challenge with getting everything or going through these assessments and then throwing the kitchen sink at their clients. How do we just go back and touch on it? I know you had done it. Just touch on how we use this flow to actually take things away from their programming, their warm up, and actually we're using this to make their program more targeted. Can you touch on that a little more, please?
I can. So as far as taking stuff away or going back to the flow of the assessment here, whenever we identify what we need to identify, then we can move on to the programming. We don't have to keep assessing. We don't have to keep testing. We don't have to keep taking them through that. Sometimes athletes need specific testing, and maybe we do. Maybe there's another level. But whenever we're talking about whatever the general population is, that movement could inform their program, and then we move on. Whenever we talk about trying to streamline their actual program, we'll use these to also look at, or really what we're looking at is movement quality. So if somebody does really, really well at a squat, then we could probably know that we could program squats, and they're going to succeed in that in their program. However, if we see some big compensations in the squat, then we may want to try to take some of that squatting pattern out of their program just temporarily until we improve that movement quality. But there, we could still work on a hinge pattern. We could still work on things for the lower extremity. So that's one way we could use this to try to streamline the actual program. Again, if we have a client or an athlete that can't get their arms overhead, well, we probably wouldn't program a lot of stuff with arms overhead. Or if they have great shoulder mobility, then we could get away with doing a little bit more upper body focused stuff, perhaps. Not exactly sure if that was your question.
That answers that question perfectly. Thank you for that explanation. And before we move on to the next slide, just so that we give everyone a review, Rodney, we have all of those kinetic chain checkpoints listed on the other half of the slide. Can you tell us, just go over really quickly, why are we looking at this for the purposes of Olympic weightlifting? What do people need to be, people need to perform these techniques optimally?
Well, in essence, what we're looking at from an NASM standpoint, when looking back and having been part of the onset of this 100 years ago, this is all about neuromuscular efficiency, as Cal talked to. We're looking at movement patterns. We want to see how well does this person move. And when we look at, we realized that we needed to have a quick and easy process to scan the body. And people, when we first started, we didn't have the checkpoints when this first came out in 2000. There weren't these checks, so these evolved because we realized that we needed to have a flow for people to actually look at the person. So let's start at the foot and work our way up was the easiest way. I know people who go from top down. So, but from this particular standpoint, what we want to do is we want to make sure that we're looking at joints and looking at the movement of the joint relative to its limbs or the bony structures. So that goes, this is what we call arthrokinematics versus osteokinematics, and people have heard that term. Osteo is bone, arthro is joint, so we're looking at how things move. So basically from that, we're able to see what the alignment of that is relative to where it could or should be, and what's the control. So what's the neuromuscular control capability of the body when we're going through these particular movements. So the body, especially in total motions, when you scan this, you're able to quickly see, hey, this looks like it's in good alignment, and it's maintaining its control while we go through the motion, or there's a deviation that's occurring. And when we get deviation, oftentimes that's an indication that perhaps there's a dysfunction. Why that dysfunction is coming is what we want to investigate. So this just lets us know, here's where things are going to be working more optimal. And this goes back to the length-tension relationships that we talked about, because we want to make sure that there's length-tension relationships and there's the proper arthrokinematics or joint motions that are going to be stemming from that. And so that's just a simple process to specifically scan whether you're doing a squat, whether you're doing a full clean, whether you're doing a jerk, whether you're doing a snatch, or whether you're doing any particular motion. You can still watch these patterns because it's going to indicate where there may be a breakdown in the kinetic linking, so to speak.
Okay, and without further ado, we're going to talk about James now. And we have James here, who is 38 years old. He's had right shoulder surgery 2 years ago, but he's fully rehabbed, so he's a candidate for a trainer, fitness professional to work with him. He doesn't have specific athletic goals, but he's looking for strength, and he's interested in Olympic weightlifting. I've met a few people like James in my time. So, Kyle, why don't you take us through how you would work with James as your client?
Definitely. Sorry, my computer is bringing stuff up on the screen to where I can no longer see what's happening. There we go. So here we are. We have James, and just like Prentiss said, he had right shoulder surgery. He's fully rehabbed. One of the reasons we put that in here is we're going to use that to kind of expand on a few of his assessments that he goes through in this process. But just like we looked at with the assessment flow, we're going to use this as our client intake, albeit it is a bit brief. And then if we can go to the next slide. So the first thing we're going to do, looking at the left, and this is just following that flow, we're going to take a look at his static posture. If we look at the static posture, I'm sure we could get really picky with some things that we see. We're just looking at a lateral view here, but if we were to look at his foot, his ankle, his knee, his hips up into the shoulder, all the way up into his cervical spine, he looks relatively well aligned. He looks like he may be a bit medially rotated in the hands, internally rotated there in the glenohumeral joint perhaps. But I often tell people, if you were to have to write a letter home to his family, is there anything that jumps out at you here that you really need to let them know about? And looking at that static posture, I think he actually looks pretty good. Some different views may give us some different information about his feet and such. If we were to look at a shift in the hip or a shift in the shoulder or anything there, but lateral view from that static posture, with the exception of the medially rotated hands, I think it looks pretty good there. We are going to take that into a movement pattern, so we're going to look at that, look at the squat. And I don't think we've talked about it, but I guess to me, I feel like people maybe assume or know why we use the squat. We use the squat because it's a total body movement. We're looking at range of motion of the ankle, the knee, the hip. We're looking at the neuromuscular sufficiency, the neuromuscular efficiency or the stability of the lumbopelvic hip complex. holding the arms overhead, looks at several things. We're looking at the sagittal plane motion of the glenohumeral joint, but also that scapulothoracic joint. And beyond that, whenever we make somebody do this for a few reps, we're also looking at the scapular stability, because we have a lot of muscles that have to maintain that position of the scapula during the movement. Now, looking at this here, one of the things with the overhead squat assessment, we use a dichotomous scoring system. So it's a yes or a no. And I often tell my students that I was a great noter back whenever I was working with more clients. So I would usually use a little plus or a minus or something to indicate whether something was maybe a slight compensation or appeared to be a bit more severe. So we could possibly use that here. But really what we're looking at is, does he compensate or does he not? And it's one of those where we can't really get lost in the details. If you're sitting there having to figure out, well, I can't really tell exactly these lines and how everything looks, then perhaps you're overthinking it, and we just need to go back with he's not compensating. And keep in mind, we have additional assessments that will come up, and we will catch those compensations later, if it is indeed an actual compensation. So anyway, looking at that overhead squat assessment, what we could identify here would be a little bit of an excessive forward lean, but thinking back to kind of following a shoulder approach with this. Look at that great flexion he has there of the glenohumeral joint. It looks like he's getting the extension he needs for that movement in his thoracic spine. So upper body there looks pretty good. Maybe just slight excessive forward lean, which we could test a little bit further for to see what we identify. Moving on to that next one there, really what we would say here is, you can go back to the other slide actually, since he's able to get his arms overhead and his squat looks pretty good, we could potentially move forward with our programming there, unless we were going to explore that excessive forward lean a little bit. Like he's demonstrating the capacity to hold his arms in that flexed position overhead for a series of a few reps. So we wouldn't have to move to that additional shoulder, those shoulder tests that we have up there. If in this picture, James, if his arms were to fall forward into that arms fall forward motion, or if he was demonstrating an arch in his low back to get up there, or if we were looking at this from an anterior view, if we saw a bend in the arm or perhaps some elevation of the shoulders, then that would be our information to move forward with those additional shoulder mobility tests. So we see there shoulder flexion, he's testing up against the wall, just checking that range of motion. We're looking for limitations, compensation. We're also looking for symmetry on his right and left side. That middle picture there of the shoulder test, we're doing internal rotation. Internal rotation is incredibly important, which Rodney can probably touch on, especially for weightlifting. We need a good bit of internal rotation, and a lot of times what we're testing here is really the back part of the capsule. So we're looking at that capsular mobility there in the posterior aspect. And then that other picture there, we're looking at that glenohumeral external rotation, looking for about 90 degrees there, or getting close to touching the back of the arm or the hand to the wall. And again, if we look at this from a weightlifting perspective, those are very applicable to the movements he's going to have to perform. So that would be a great series of tests to tell us a lot about how James' upper body here is functioning overall.
Okay, so let's take a look at the next slide. So we're assuming now that you identified that everything looks pretty good with him. There's nothing really to speak of regarding his shoulder mobility and stability. So now we want to move forward into the loaded assessment. So what are we doing? What are we doing here? Why did we choose these movements? And how do we take our client through this test? Let's ask you, Rodney, since
essentially in looking at the loaded, we just want to see, as Kyle went through, when he's unloaded and when it's just his body weight in open space, he looks fairly good. It looks like he's moving fairly good without getting overly nitpicky. So now if that's okay, if that's the case, then let's see what happens when we just put a little bit of load, because what we want to do is find out under force, whether through speed or load, what's actually going to happen with that particular person. Is something going to change or something going to appear? And so here we obviously have a fairly light load. It's not real heavy. but we just want to take them through a couple of motions. Now, the high pull goes back to your internal rotation we talked about. So when I do that, and especially looking at shoulder, can I see anything happen differently? And we know that he had a right shoulder situation. Can I see anything different between his right and left shoulder? Yes or no? Is there anything that's changing, and is he able to move that? Do I see trap dominance? So would there be a difference in right trap dominance versus left trap dominance, which may indicate that potentially the trap is overactive and there may be other components in the shoulder girdle that may not be working as effectively as need to be, and just see if they're not one from a range of motion standpoint, what's the height, and then also from compensation, are there any compensations that are occurring? And then we want to see, is there a fatigue factor going on? So if we're going to do 10 to 12 repetitions, does one side start to fatigue versus the other side? Because those will be indications that, yes, that right shoulder is good to go, or no, that right shoulder may need a little bit more work. So we want to be careful what we do going into his program. And so that would then specifically allude to what we might want to do from a corrective standpoint. Overhead press is just the same thing. So we want to look at exactly what we were doing with the overhead squat, only now he's loaded. So as he goes up, is there symmetry between both sides? Yes or no? Is there any compensation? Again, is there any type of trap compensation? Are both arms fairly equal in relative to the head? Or are we getting some deviation? One's moving outside, and or is he not able to lock out on one side? Does he have to stay down or kind of bend the elbow? Because that could be an indication that there is some type of neuromuscular inefficiency going on. So that's the reason to put those under load, and the reason why we do that, because a lot of weightlifting will include overhead lift and will include that high pull motion in order to get into the catch position.
Okay, great. Thank you for that. And just one quick question. Can you explain to us again what the rationale is for using 5% body weight as the testing weight for these two?
Just a lower percentage, and just so it's relative to the person's body weight.
Okay, great. Thank you. So let's take a look now at what we're doing from a corrective exercise perspective. Kyle, can you please talk us through the continuum again, and just let's review what we want to accomplish at each phase of this corrective exercise process.
Definitely. And what we have to ask ourselves here with James is if he is actually a candidate for a corrective exercise approach. If he's done well in all the assessments, all the mobility test, or the transitional assessments to the mobility test to the loaded test, if we put him in at a more dynamic position to do some dynamic testing, if he's done well in all of those, then that is demonstrating that he has the movement capacity and the ability to go right into a training program. Now, whenever I say training program from my perspective, that means we go right into the OPT model. And then where he starts in the OPT model is going to be determined by his experience, his ability, his goals, all of that type of fun stuff. And one of the things we'll look at Monday is the OPT model is not going to be quite as strategic or specific as a corrective exercise approach, but it still follows the same principles. We see that these same principles are repeated in both the corrective model and the regular OPT model. But again, it just may be, I hate to use the term general, but it may be slightly more general than what we're going to do here. So if we see a compensation or an impairment or something with James, then we would take him through the more specific corrective model here. The first thing we're going to do is inhibit. So that's going to be using a foam roller or whatever we have available there to do self-myofascial rolling techniques. A couple different things we're trying to do here. We want to identify the overactive muscles and reduce that activity, or down-regulate, so to speak, but we're also going to use this to mobilize some stuff. So this is something that could be used whether there's a compensation or not, really, because we're going to use the roller to improve some blood flow, mobilize some tissues. Being upper body stuff, we'd try to get us some thoracic extensions. We're going to start there, identify a few muscles. Then we're going to take the muscles that we identified as being short and lengthen them. So this is going to be static stretching or neuromuscular stretching. Then we typically look at the other side of the joint, and then we're going to try to upregulate or activate certain muscles. That's going to provide us more stability to the joint. And then the last thing is integrating that in to a total body motor pattern or something that's more specific to James' goals. So that's going to be our 4-phase approach.
Okay, perfect. So now let's go into specific techniques. Why did we just talk us through these foam rolling techniques, and why did we select the exercises that we did in these 2 images?
So thoracic, you want me to do that one?
Yes, please, Kyle. Continue.
So the thoracic spine, that's one of those that it comes up a lot. If you look at all the things we list out in our solutions table and our charts and most of our discussions, we're always talking about muscles, specific muscles. But here we're actually talking about the spine. And what that means is we're trying to get movement to the thoracic spine. So the muscles that lay over it, the spinal erectors, the rhomboids, the parts of the traps, they're not always short and overactive. So a lot of times it's just people are just stuck in that kyphotic position. So we're going to try to get motion to the thoracic spine. This is great for a weightlifter. This is great for somebody that sits at their desk all day. This is great for a lot of different people. So this would be one of those things. If you're working with a client, you don't know what to do, have them roll their thoracic spine. They'll probably love you for it and they'll feel better afterwards. So that's why we're choosing that thoracic spine rolling there, getting some mobility, getting some movement. We need thoracic extension to get our arms overhead. We could do some different things with the position of our hands. You can put behind your head here so you can actually relax back into it and relax the muscles on the anterior aspect of the thorax. Or if you want to separate the shoulder blades, you can also do like James is doing, and you can give yourself a big hug, gets the shoulder blades out of the way, and you can get into some of the tissues there. That next one, he's rolling the lats, or at least a portion of the lats. This would be something that we would want to roll if we see the arms fall forward, or if somebody is unable to get their arms all the way over their head, or if some of those overhead movements, if they're demonstrating an arch in their low back. All of that could be tied back to a mechanically short latissimus dorsi. Another thing we could roll here, James could just roll over a little bit more and start to get into the anterior aspect of the shoulder, specifically the pec minor, which plays a big role in the position of the scapula as we try to do overhead movements.
Okay, great. And why don't you continue, Kyle, and let's talk about the lengthening techniques that we've chosen here for this lifter.
So just a couple of simple techniques here to try to integrate into a program. And going back to some stuff we've talked about, we won't get into a lot of details, but whenever we perform lengthening or whenever we perform stretching, we need to remember that we're not literally stretching out that muscle fiber. We're just trying to influence the stretch tolerance. So we want to take to the first point of tension, hold that for a period of time, repeat that on a regular basis, and eventually your body will demonstrate increased extensibility of the muscles. Whenever we look at the picture of James in the chair there, we're just trying to get thoracic extension. One of the things we may want to watch here, if you see kind of mid-torso, it looks like his rib cage is popping out a little bit. That little rib cage flare may mean that there's some lumbar extension. So you may want to cue James here to just contract the abdominal complex to pull the ribs down. And then I would do this going through reps, do 6 to 8 reps of extend, holding for 1 to 2 seconds, and then relaxing, just trying to get that thoracic extension. The picture on the right, it's going to be just a basic latissimus dorsi stretch. There's a lot of different ways to do this. I generally lean towards doing it in a kneeling position here if your client can, because that will help us get a little bit of a posterior pelvic tilt, which will help increase the lengthening or the attempt of lengthening the lat. And in general, we take to that first point of tension, or when you first start to feel the tissue stretch, and then we would just hold that. One of the last things here, this is an active process. We want our clients engaged, maintaining neutral posture. We want them thinking about what they're doing, mindful in this approach, not just hanging out, laying there, just hoping that the tissues will lengthen over time.
Absolutely. So now as we're moving down the continuum, we're going to get into some activation exercises. And we have a couple of different ones here. Rodney, can you talk to us about these activation exercises and what we're trying to accomplish with each of these movements?
Yeah, so your activation exercise is really just to start to create a neurological connection or reconnecting. So you just want to start to increase some activity, and that's why they're performed for some holds. Oftentimes there'll be a little bit of a hold, or there's more of a static component to it at an in range, so to speak. And in this one on the left-hand side, maybe a little bit more exaggerated than need be, but really what we'd want to do with this is activate the serratus anterior, because the serratus anterior is a huge component of shoulder mobility as it works with the upper trap and middle trap, rhomboids, and lower trapezius, as they have a big steering wheel that turns that shoulder girdle for us. So what we could do is, in the top picture, probably could be a little bit more neutral, but you're going into a pressing motion. So it's really just pressing the shoulders forward and then letting them retract. And that's just to get good thoracic mobility, just to allow the slide. But as you're pressing up, you're actually pushing and creating a little bit of serratus anterior activation. So you're working specifically on that. And then the other one is just, here we're just kind of going into whatever you want to call it, as almost like a Superman. And with your arms coming up like that, obviously that's going to work. Deltoid, lower trapezius is going to be a huge component of that. And those are all extremely important stabilizing muscles anytime you get your hands above head. And as we talk in the Olympic weightlifts, those are going to be important components, and you need to have stability and activation. And then coming back into the cobra position, which is obviously good for lower trapezius as well as even the rhomboid complex, especially when he's in this position where he's able to come back and lift his shoulders off like he's doing. So that's just the reason. It's just really working around the shoulder girdle, as we do know that there was some type of shoulder. And again, even though we didn't necessarily see something specific happening, we have to remember that, one, he's new to weightlifting. He's interested in doing it. So we want to make sure that with that shoulder injury, he's probably never done some of the things that we're doing. So we want to make sure that he can have that stability going into the motion steps.
Okay, so we've gone through the first couple steps. Did you have something to add, Kyle?
I do. So remember, too, we talked about James being a little bit medially rotated. And notice here on his Cobra how he's going through external glenohumeral rotation whenever he does that. So that's one of those, oftentimes people perform this medially rotated. But definitely with James here, we want to be sure we're getting that external rotation, the thumbs rotated away from the body and maybe up to the sky to help offset some of that medial rotation we saw and may get us a little bit more rotator cuff activation out of this movement as well.
Perfect. And so now we've gone through the first couple of steps, and I just want to remind everyone that this is important to do, because when your clients are coming to you from off of the floor, they're bringing with them the stuff from their lives, which may be some stress, maybe some car rides, it may be doing a little cattle roping. But you want to, for Dr. Stull there, so you want to help them take some of that stress off and help them to create that range of motion to prepare them for work. Now, we've worked through the first two steps of the process now, or first three steps, and we're going to do some new integration exercises. Well, they're not new, but in the context of corrective exercise. Rodney, can you take us through our integration exercises and tell us why you picked these and what's happening here?
Yeah, so this has a couple of reasons. So this is a modified kind of muscle clean, and so muscle clean a lot of times it's almost where you're taking the legs out of it, so to speak, and you're just pulling the bar through the motion. It can be done fast, or it can be done, in this particular case, it can be done just a little bit slower. So one, it's to create more of a total body motion that's integrating all of the inhibitory and the lengthening and the activation exercises that we've just gone. It's now applying them into an actual sequence. So he's going to be going through that high pull, the internal rotation, to kind of an external rotation and catch. So that's part of the other part, is that it's actually teaching him the movement that's going to be involved in a clean. So he's basically starting at the hip, which is oftentimes called the power position. He's going to go into a shrug, and then he's going to go into a high pull, and then he's going to bring the elbows through, and he's going to get into that position. So that's the position that he's going to go when he is going to do a clean. And so it's a teaching exercise as well as it is a range of motion integrated movement exercise to actually put everything together for him.
All right, perfect. So let's take a look at the second integration movement, and we have the squat press to thruster. Why did we pick this one, and what do we want to accomplish with this particular integrated movement?
Same thing. This one now we're just bringing in the lower body. So the first one was more of a technique. This one is more of a total body integration to where we're going overhead now. So we're just going to simply use a squat. So getting him used to doing a front squat, which will be part of the clean, and then getting him to go overhead with the bar. So just putting the two together. And again, it's just at a nice controlled pace. It's actually a great core exercise. And so it'll be something that will just prepare him for what's going to come down the road, but get him acclimated through his corrective exercise program that we've established. So it's a way that we can bringing in some of the movements that they're going to do, but breaking them down to where they become an integrated component of the corrective exercise. It's how you can bleed the two together.
Okay, perfect. And yes.
What speed are these performed at? Are these
more of a moderate speed? Yeah, that's a great question, Kyle. So more of a moderate speed. So these aren't to be done at full speed because one, remember, he was interested in learning, so he probably doesn't know how to do them, or isn't super familiar with the clean in this particular case. So just going through a moderate pace so he gets the feel for what that's going to happen. So a moderate tempo.
Okay. Great. Now, I have another follow-up question to that, and then we will get to Lauren. For parts of the lift that require, I know we had talked back and forth as we were working through these webinars, and you mentioned the drive shrug as one movement that we could use. So for parts of the lift that require some type of explosiveness, that triple extension, for example, do we want to honor it at that part of the exercise and keep that, I don't know how I'm asking this, but close to how they would perform that, and move slowly, possibly through some of the other movements in the lift?
Yes and no, and I think that's a great question. So the drive shrug is where they'd pop up and they would be exploding right up into that shrug with elbows locked still. So the answer is, if the person has done that before, then yeah, have them pop that up. If they're not, get them used to going into a shrug and triple extension at the same time. And remember, when we say triple extension, preferably we can get up onto the toes.
Sure.
So one of the things that works really well is if you can get up onto the toes into triple extension, you got your toes, knees, and hips locked out, and you're basically in that triple extension period or position, and you're activated in that. So you're active and engaged, like Kyle had talked about. It's not just going through the motion, hoping everything does what you want it to do and call it a day. It's getting to that and then getting them used to shrugging at the same time that they're going through that position. So it can be a little bit slower. So it depends on the person's ability and where they're at.
Okay, perfect.
Question?
Yes, thank you. So now let's get to Lauren on our next slide. Now, Lauren's 28. She doesn't have adverse medical history, but she wants to set a new PR. And I've read through this. We've talked about this. Rodney, this is someone you've worked with. Can you take us through the process?
Yeah, so everyone meet Lauren. Lauren is our education manager at Eleiko. She's personally a former competitive weightlifter and just an awesome all-around person. Now, as we go through this, I want to make it very clear that this is not specific to Lauren. Lauren is going to represent actual case studies that I've seen over the last couple of decades on multiple occasions. So I've seen some that are almost identical to what you're going to see in more than one or two cases. It's probably close to half a dozen over the last 20 years. So what I'm doing is I had Lauren take some pictures for me that replicated the case studies so we could use this process to specifically show you guys. So I want to set that up right off the bat. This is not Lauren. She's not this jacked up by any means.
Yes. And I apologize for even insinuating that, Lauren. Please forgive me. But let's go into the case.
Let's tell you she's got plenty of issues that she can run, but this is not one of them.
Okay. Let's take a look at her static posture and what's going on in her transitional assessments. Let's go, Rodney.
So you guys can see the static posture, and we don't have to pick it apart. I mean, we could touch it, but for all in all, Lauren is a very good athlete. So, and I mean that from people that I've worked with. I've worked with people who are very much like Lauren, and they've been in the very same situation. That's why she was kind of a perfect fit for this particular case study. So when we do the overhead squat, because she's used to doing the snatch, and what she wants to do, remember, her goal is she wants to increase her PR, her personal best that she can do for this. So what we want to do is, I had a lot of people, a lot of times when they do an overhead squat, I'll have them use a dowel rod. Not that you have to, and it's not a necessity, but it gives them something to hold on to. So a lot of times you can see if there's any discrepancy in the upper arm. But when she went through this, when my people that I've seen have gone through this is something that pulled out. So when you look at from behind, you notice that there's a little bit of asymmetry in the leg. So that left knee looks like it's coming in more so than the right knee. And then when you look at the hip, I brought up a close-up because this is something that it almost looks like one of the glutes is dropped down, or there's a shifting. It's almost like a inferior, superior, inferior change in the hip height. And so it was really interesting. So now with the CES flow, the assessment flow that we have, this is where it becomes very valuable for us. So when you see something like this, my immediate thought was, okay, well, let's go and start with the first modification. So on the next slide, we look at the first modification. The first modification on the next slide was let's lift the heels. Now, we lifted them a little bit. You can obviously lift them more. You can lift them an inch or so. And Kyle, is there a standard that you guys prefer to have?
No standard. Usually an inch to an inch and a half is pretty good. Having like a 2x4 or something laying around the gym is great because it's easy access.
Right, and don't get confused by the 2x4 because 2x4, it's not really 2 inches by 4 inches, but it's just the way it goes. So on this, we just had them on basically a 5-pound plate. So when you look at the left picture, you can see that the knees straightened out and the hips cleaned up a little bit. So they're not quite as dramatic. Still has the hands overhead, so it looks fairly good. So we could think, and those of you that are way ahead of this may say, oh, well, maybe this is what's happening. Well, hold on to that, because then when we took her arms down, you can see their hips went back to the way they were. The knees stay okay, but the hips went back to the way they were. So this got really interesting. And now, again, I've seen this happen at least 3 or 4 times, maybe close to a half a dozen in this same case. It wasn't necessarily the left hip in this case, but so now we're looking, okay, wow, we've got a straighter stance, but we still have this hip issue going on, and we've modified both things. So now I went to the next slide, and now I'm just following the flow, and I said, well, let me see what happens on a single leg. So single leg, her right leg's basically money. And now, yes, you can put your hands on your hips, and there's all those things, but when we look at using the same with both legs, even though her hands are out front, the right leg is money. That's what you want to see. You want to see someone that the pelvis is basically parallel to the floor and their ankle, hip, and knee are pretty much stacked up. The left side is jacked up. So we've got an issue with that knee. And even though it's not so much that the knee deviates, it's actually a little bit of a hip shift, and she's starting to pivot and rotate. And if you were to look from the side angle, what we would see is there was also a rounding of the low back. So there was basically, she was going into a posterior pelvic tilt as she was going into this position. And there's been guys that have done the same thing, but the 2 females that I have in mind when I'm talking about this. So we can see, okay, there's really something going on with that left side. So we noticed that there was a little bit of cleanup when we lifted the heels. And then when we took the hands down, even with the heels lifted, the hips got worse. We see that there's something more specific to the left side. So then we went one step further, and this is when we went into the range of motion assessment. So now if we go to the next slide, going into the range of motion, all I did was use what we would say is a modified Thomas test, but instead of looking at the hip extension, what I wanted to do, or what I noticed first is what I should say, because originally in the first person, I was going through the modified Thomas test, but what I noticed before they actually grabbed onto their leg to go into the modified Thomas test is I noticed this. That left hip couldn't come up past 90 degrees, but the right hip could. So I had them do that a few times, and I realized that that left hip can't get up high enough, but the right hip can. So that led me to, and then through goniometric measurements that I had done on the person previous, that led me to think there may be something going on with that left hip, and it may not necessarily be an ankle situation that we thought, and in fact it wasn't, because the ankle range of motion was great. So there's something going on in that hip. So I realized that, okay, there's a left hip situation, and what was happening is there was a lack of hip flexion. And we always look at, and this is what I wanted to really bring up and why I use this particular case study, a lot of times you guys, and I know that people have made comments that there can be the similar issues with tight and weak muscles in everybody. But in many cases, that's not the case, and that's why you need to have an assessment flow chart that leads you to specific things where you can start looking. That left hip did not have the ability to flex as well as the right hip, and that was what was happening, is because when she would squat down, your hip has to go into flexion, which means there's an anterior tilt relative to the femur, and that's what's creating the hip flexion. When she got to the point where she could no longer flex on that left hip, she would go into a posterior tilt. And so that means that that left hip would basically stop flexing, and the right hip would continue to flex, could have the ability to. So left hip stops, right hip keeps going. And that's why we saw the overhead squat the way it was, and that's why we saw this hip flexion assessment, which is what it turned into, this hip flexion range of motion the way it was. So going to the next slide, wanted to do the Davies test as a dynamic assessment. I didn't want to do dynamic with her because obviously that left side had some stuff going on, and so there wasn't. A great dynamic assessment that you could do for someone who's Olympic lifting could be a squat jump. So a squat jump is just going down into a quarter squat position, and from there they have to jump up and see how high they can go. That's giving you basically a concentric explosion. How explosive can they get? Because going from that quarter squat position upward is extremely important. You could do a vertical jump if you want to, but a lot of times vertical or counter movements using the eccentric before the concentric. Weightlifting, it's more concentric explosion. But because she still wants to do she's going to be doing a lot of snatching, and she wants to increase her PR, and snatching is taking the bar overhead in one motion, just wanted to see how her shoulder stability and how her dynamic movement through the shoulder girdle was. So we used a Davies test as well. Those who don't know what the Davies test is, it's in a push-up position like you see. Hands are about 36 inches apart, and then you're timed going back and forth to see how many times you can touch the hands or how many times you can touch your hands in 15 seconds. So based upon all that, now we have to, and you can go to the next slide, Greg, that's fine. Based upon all that, we're going to run through the same process. So taking all of this information, what we want to do is to make this corrective exercise very specific. When I've seen these, took it straight to the left hip. So we're not going to go just the whole body and just kind of do everything. We're going to go right to that hip and see if we can help clean things up. So on the next slide, what we did from the inhibitory using the self-myofascial release, Greg, on the next slide, is went to the glute and the adductor complex. And people say, well, why would you do both sides? Because the hip wasn't moving. And so without getting into all of the goniometric stuff, what I wanted to do is get to the hip and see if we could loosen up the femur and the ability for that femur to move in that acetabulum and be able to rotate and turn and go into flexion and extension and internal and external rotation, which you need to have for flexion and extension. So we went to that glute, and we worked on the backside, and we went to the adductors, and we were staying a little bit higher on the adductors, because don't forget, all of your adductors insert up into that pubis, and that pubis is where that anterior capsule also sits for your hip. And all of that tissue, to what Kyle was talking about earlier, is just because something's not necessarily mechanically short or not necessarily overactive that you may or may not think it is, it still can have an influence, and that tissue can still have, it still be a little bit grungy. And so that can still affect how that joint will move, besides just the muscular components to that. So we rolled the adductors, rolled the hip, and in the next slide, what we did from a stretch is we just wanted to open up that hip a little bit. So we just did kind of a kneeling adductor stretch. Just opened up that hip a little bit and just had kind of a real subtle motion. And Kyle said it perfectly. You take it to the kind of the point of first tension and let it do its thing, and then we'd come back. And we did that, and that's all we did on that particular hip. And then the next slide from the activation went back to what you saw on the slide with the activation. Remember, there's positional isometrics, and then there's kind of the isometric exercises. So we did a positional isometric on this particular left hip. And so on this one, and Kyle, correct me if I'm wrong, but positional isometric is basically 4 repetitions, the first one 25, and then the following 50, 75, and 100. Is that still the process?
That is the process the way I understand it, yep.
Yeah, so we used something very similar to that, but what we wanted to do is hold that for about 5 seconds. 5 to 6 seconds is what we held that for, each one, and then release, and then have her bring it up as high as it can go. And as you can see, and Lauren actually did a great job representing that, that hip dramatically increased its ability to go into flexion just by going through that positional isometric process. So we use this to help activate the tissue that wasn't able to actively pull her into that position. So remember, we weren't doing an assessment to see, like a hamstring assessment. We wanted to see, can she actually get that hip up? And she couldn't the way the one was, and it was fatiguing. It was almost like it was fatiguing on her. So we just wanted to activate that. Then we used a side plank, and we just integrated a hip flexion motion with the side plank. And very simply, with now this one's on the right hip, but we did it on both sides. Because on the right hip, she's getting that left hip flexion. But remember, when I'm in that side plank position, and I'm moving that left hip through flexion and then back down into a straight position extension, then I drop down, come back up, and do repetitions of that. I still have to hold that hip up in abduction as I'm going through flexion. So I'm still getting the abductors, glute medius, TFL, to still work because they're both flexors. So your anterior component, the glute minimus, and then portions of glute medius also flex the hip as well as the TFL. So we're getting some abduction strength. And the reason we're looking at that is because when she was on a single leg stance doing her single leg squat, she was having a lot of trouble with that left side. In the overhead squat, we noticed that left leg cave in a little bit, that left knee. When she was on a single leg, there was the knee looking like it was adducting and the hip was actually shifting out. So there potentially could have been some weakness in that. So that's why we chose those 2 particular exercises, to try to increase the activation of the hip flexion component and then be able to work on the abduction as well as some hip flexion in this particular case with her. And then for the integrated exercise, we did just a very simple movement that she has to do for a snatch, and that was just an overhead squat. So it's a great exercise just in and of itself. And if you were to take that exercise, the corrective exercise program that we just went through, and did it on yourself, you would immediately notice, and if you just did it on one side, not the other side, you would immediately notice a difference in that side that you worked on. And so that would be my challenge to you, is go through that, because you'll see what she experienced and the people that I work with. Because what then happened is she was able to move much better in her overhead squat. And so in this particular overhead squat, all we did is we would go down and she would get to the point where she could be comfortable, and we'd have a hold it there for a couple of seconds just to get the tissues acclimated to holding in that position, and then have her stand up tall and then come back down and doing that. So that was the corrective exercise that we did in this particular case, and that's how it was able to help this particular set of people that I work with regain proper movement. And it was fairly quick. In two of the people's cases, it was almost immediate, where they had a pretty dramatic change in their ability to squat and get back to where they needed to go. And that's it.
All right, outstanding. So when you're doing the overhead squat as an integration exercise, are you still using the same volume, 12 repetitions of that exercise?
Yeah, so again, that'll go back to what you want to do. So if the person can't do the 12, you either do a dowel rod, or you do a variety of different things. You can do in between every repetition, you could take 1 or 2 seconds of rest and then do it again. Or you could do three repetitions, rest for a second or two, 3 repetitions, rest for a second or two. So if you're looking to get to that 12 rep, then you would have to potentially break it up depending on how strong the person is and how much load you're using. Hopefully you're not using too much of a load to where they can't get to 12. So that's where the dowel rod can be extremely important, because it's not about being under load as much as it is about performing the actual integrated motion. But having the dowel rod keeps the hands in the position that you want them to, which will put tension through the whole system, which is what we're looking for. And it makes them have to squat in the position that they're going to need to when they're doing a snatch anyway.
Yeah, and just wanted to pick up on that really quickly. Hand position's obviously different because we're training this in the context of Olympic weightlifting. Just tell us real quickly about how one would set up for snatch grip.
Yeah, so in a snatch grip, one of the easiest ways is you just hold the bar, and you're going to bring your hands out on that bar until the bar gets to about the crease of your hip. And so all you'd have to do is, if you're holding that bar, if you were to lift one leg and flex your leg up, you should be able to flex the leg without the bar being moved. And that's one of the easiest ways to do it. So you can lift up your legs and make sure that the grip is wide enough. And so that's the easiest way to get the width that would be proper for you in your body position, body size relative to the bar.
Okay, thank you. And that program that you laid out there just goes to show you that the possibilities are endless, and you really have to put your detective hat on and don't put yourself in thinking everything is a tight hip flexor, and we never want to do anything to activate those hip flexors, because as you all can see there, that was the solution to getting this athlete to move optimally for the snatch. So we are at the end of the webinar today, and yes, Dr. Stull, you had a point.
One of the things I wanted to say is, whenever we were talking about that assessment flow, I had talked about how if you see a compensation here, you can move on to your programming. But I think what Rodney just went through there was a beautiful example of how you use the next test instead of jumping to the programming prematurely. Perhaps use that next test to get more information. And it's important to see that Lauren had the physical ability to perform the test safely, and it matched her goals. So if that's your client, continue, and you have the time and everybody's on the same page, you can continue using those assessments to dig deeper. And if Rodney wouldn't have, he probably wouldn't have identified that the specific cause, if you will, and also led to him being able to put together a program to correct it very quickly. Yeah. So nice job.
Yes. So thank you both. That was very informative, and I hope everyone out there listening at least took away several nuggets that you can implement immediately when you're training yourselves, because you're your first client, and also when you're out there working with your clients again. Right now, it's time for a little bit of Q&A, so if you have questions, please type them in. And before I ask these gentlemen to give us their main takeaways for you today, you can save 35% on the new CES course using the code webinar21. That is a phone-only code, and you'll have to call 888-773-1827 to redeem that discount. And you can also save 50% on Eleiko apparel and equipment using the code capital NASM, lower code WEB 15, and go to strengthwear.us to redeem that discount. And while we're waiting for questions, gentlemen, do you have any takeaways? Let's start with you.
Yeah, I think, Prentiss, you touched on one of the biggest takeaways is, number one, there is an assessment flow to allow you an online methodology to go through and gather information on someone's movement capability. The more you know, the more you can do with that. And I think that's really important, and the need for continued education and continued growth. But don't ever think that because most things look a certain way, hip flexor is the one that's everyone wants to stretch it and poke it and prod it and do it. It sometimes it's opposite of what's actually going on. So just have an open mind and don't be stuck in that, because you can make some great gains with people by exploring options, using a process to allow you to go to different areas and continue to get more education around how the body works and what the assessments are actually showing you or telling you.
All right, great, thank you. And before I get to you, Kyle, we have a question from Joel. Thank you for attending today, Joel. He wants to know, with Lauren's case, did you notice any specific trigger points that were active or troublesome?
All right. So that's a great question. So remember, I've seen this a few times. One of the areas that had the most probably trigger point activity was in the glute area. There was glute medius, and that's an area that many people have, kind of your posterior glute medius, and between the ischium and the greater trochanter, there's usually a really hot spot. There was that, and there was also some in the piriformis region. Those were two really big hot spots. So, was in the adductor complex, while there wasn't a lot of trigger point activity after the foam roll. So personally, what I'll do is I'll have someone do a foam and do some type of movement again, and then do the foam roll, because I want to see if one is helping more than the other. Because what we want to do is we want to whittle it down to what exactly do I have to do? What's the most important thing to do? Not just throw everything at them and hope something worked. And while the trigger point activity was more helpful from the back, or more apparent in the back, it was actually rolling that front of the hip, the adductor complex, and loosening that up, that actually freed that hip up to move. And that's a whole nother webinar in and of itself, as to why something in that area would do that. But that's what it was from a trigger point standpoint: posterior hip and piriformis.
And on the trigger points too, we need to keep in mind that the body is very intelligent. A lot of times it puts those trigger points there for a reason. So we can't just always think, well, if there's a trigger point, we got to release it. We got to release it. So I think, like what Rodney's saying there, going after the anterior aspect of the hip, you do that enough and improve that iliofemoral motion, the trigger points may actually just go away. The body doesn't need them anymore.
Well said.
You're on mute.
Prentiss, you're on mute.
No longer on mute. Can everyone hear me?
Yes, sir.
All right, perfect. And we have a question from Arash, and he wants to know, and thank you for attending today, Arash. For an otherwise healthy person, the reps and sets for these corrective exercises, if used for technique building prior to lifting, I think this one's going to be for you, Rodney. And when lifting or when doing Olympic weightlifting, how many reps and sets should you go for?
I'll defer to Kyle for the NASM kind of corrective exercise set and rep scheme for the apparently healthy person, if that was the question from a corrective exercise standpoint, and then I can talk to the Olympic weightlifting.
Sure.
Yeah, so we need to think of this from a little bit of a endurance perspective, but as well as a, for lack of a better term, a perfection perspective. So in the text, we often encourage or suggest between 10 to 15 reps. And then on some of the integrated exercises, we may get into the phase one endurance, where we talk about 12 to 20 reps. But one of the most important things to keep in mind from a corrective standpoint is we need perfection in the movements. So don't set a goal of your client of 12 reps and then they do whatever they need to do, compensate or not, to get to 12 reps. If they can only do 6 reps with great form and then they compensate or cheat, stop them at 6 reps. And then the next set, they try to get 7, then they try to get 8. So we have them laid out in the text, but work with your client and make sure they're going through the movement, full range of motion without cheating, doing as many reps as they can.
Yeah, and I just want to tag on to that. That's a huge point that so many people, they look at the set rep scheme sometimes and they, I got to get that. If the client can't get it, it doesn't matter. So what can they do and what can they do effectively? Prentiss, what was the question relative to the Olympic lift?
Yes, he wanted to know when you're Olympic weightlifting, how many reps and sets should you go for?
Well, that's going to depend obviously on the person's ability level and what they have. So it could be anywhere from 2 sets to 6 sets. It could be 8 sets. It depends on how much other stuff they're doing and what specifically you're working on. Rep standpoint, usually because the skill component of the Olympic lifts, usually the reps are going to be a little bit lower. More than not, you don't need to really go over 6 repetitions because, again, it's going to go back to, because it's a more skilled movement, you want to make sure that it's done correctly and not just done to Kyle's point we just talked about. So anywhere from 2 to 6 sets and up to 6 reps. Anywhere from 1 to 6 reps, depending on what you're working on, is a pretty safe ballpark.
All right. Thank you. And Kyle, do you have any takeaways for our listeners today?
I do. So what I said earlier about the assessments. So work with the individual that's in front of you. And sometimes, even though we provide the assessment flow to be simplistic and efficient and effective, sometimes you need to dig a little bit deeper. And then also to Rodney's point about education, and don't think of education as only coming from a book or a course. A lot of this education is the experience of working with clients. The only way you'll be able to recognize some of these little nuances of movement that require additional testing is if you just start working with people. It's not going to be perfect at first, and that's okay. You may mess a few people up. Hopefully not, but it's not going to be perfect, but you'll just reassess and redesign, but just start working with people.
Yes, practice. Yeah, practice experience is a really good teacher because you have to have a way to synthesize everything that you get from your mentors, your books, and then additional courses. Well, that's all the time we have, and I almost finished on time today. So I want to thank both of you for hopping on and educating us and helping us learn how to implement corrective exercise into Olympic weightlifting. And I have one more day with you, gentlemen, and we're going to put it all together into a program. We're going to do a little program design on Monday, taking you through 3 levels of the OPT model, and that should be fun. That's one that you don't want to miss. Thank you, Rodney. Thank you, Kyle.
Thank you.
And of course, and thank you for everyone who hung out with us this afternoon. Everyone have a good afternoon and a safe weekend.